Protection and security before, during, and after insecticide use. Insecticides are used in public health as a tool for controlling vectors that transmit diseases. It is important that health workers responsible for the use of insecticides be familiar with the technical aspects of insecticide use, handling insecticides, the equipment used, health hazards to workers, health risks to the population. Preventing poisoning. Throughout the process of applying an insecticide, the worker is exposed to the substance, and poor handling, ingestion, contact, or inhalation can lead to serious health problems. It is important for the person who is in contact with an insecticide to know the risks involved in handling it and how to avoid them. Read the insecticide labels to know the level of risk you are exposed to. Insecticides used in public health are safe and are produced according to the guidelines of WHO's insecticide evaluation scheme. Exposure to an insecticide occurs when it is opened, mixed, and applied. Some of the most common forms of exposure to insecticides are from inhaling toxic vapors in closed environments, preparing and applying pesticides without proper clothing and protective masks, transporting equipment along with the health workers, entering an environment where an insecticide was recently applied, eating food that has been exposed to insecticide, exposing skin wounds to contact with an insecticide. Mother-to-child transmission is also possible when a pregnant woman has been in contact with pesticide. Women who have been exposed to insecticides during breastfeeding can transmit it to the baby through breast milk. It is important to know how to recognize the symptoms of acute poisoning so that the necessary steps can be taken immediately. Symptoms of acute poisoning are numbness in the face, especially around the mouth and in the arms and legs, dizziness, mental confusion, in some cases vomiting and diarrhea. Prolonged exposure to insecticides without proper safety equipment or failure to comply with safety standards can lead to chronic poisoning in the operator. What to do in case of poisoning? First, the symptoms of poisoning need to be identified. If the insecticide was in contact with the skin should be washed immediately with soap and water. If the contact was with clothing, the clothes should be changed immediately. If any of the symptoms appear, it is important to inform the supervisor immediately. If necessary, the affected person can go to a health facility. Protective measures. Before beginning work, remember to use gloves, protective masks, and goggles. In addition to clothes used specifically during application of the insecticide, protective equipment should be used throughout the process, from mixing the insecticide to its final application. Insecticides can impregnate clothes. Thus, once the work is completed, the work clothes should be washed in a place where they are not in contact with clothes used for everyday purposes and should be separated from family clothing. Avoid bathing or washing the clothes in rivers or public pools. When the work is done, the operator should take a bath and wash hands and face before eating. If insecticide is left over when the work is done, it should not be repackaged and must always be kept locked in a safe place. In order to prevent poisoning, insecticide application techniques should always be followed. Remember not to eat, drink, or smoke while working with insecticide. Risk communication for the community. Before beginning insecticide application in a dwelling, the owner should be told what time the procedure is expected to begin and its purpose. Residents should be given time to leave the dwelling. Cover foods, kitchen utensils, water containers, pet foods, and toys. Neighbors and their pets should also leave their dwelling. When the insecticide application is complete, neighbors should be told to wait at least 30 minutes before re-entering. As soon as the residents go back into their dwellings, they should open all windows and doors.